Have you seen advertisements for CBD oil or seen new CBD shops open around your town? Or maybe you use CBD regularly and haven't been able to talk to a healthcare provider about it. Hi, I'm John Howard. I'm a pharmacy resident at Kingman Regional Medical Center, and I'm here to talk about cannabidiol, which I'll refer to as CBD for the duration of this video. In this video, I plan to explain the differences between the types of cannabinoids, review the evidence for and against the use of CBD, and then also discuss safety information regarding CBD so that you can make an informed decision if you decide to use CBD and how to use CBD. There are two major types of cannabinoids that I'll be talking about in this video, and I wanted to point out some important differences between the two. First is CBD, or cannabidiol, which you can see in the upper left corner. It's one of the major non-psychoactive portions of the cannabis plant. It does not generate a high like you might associate with marijuana, but side effects include tiredness, changes in appetite, and mood changes as well. On the other hand, the more psychoactive portion of the cannabis plant, also known as THC, does generate a high and also is associated with some side effects such as increased appetite, problems with memory, difficulty focusing, or performing mental tasks. Which leads to the question, is CBD the same as marijuana? The short answer is no. While there is CBD found in the marijuana plant, it's also found in other varieties of the cannabis family, such as hemp. Regardless of what plant the CBD comes from, it does not cause a high like you would expect with THC. Which leads to the question, how does CBD work? And CBD works at different places all throughout the body. It binds at several different receptors that are different from the receptors that THC binds to, which explains why the two have different effects in the body. You might also be asking, are CBD products legal? And as of April 2019, there are only 3 states that have restrictions on cannabis and cannabis-derived products, and those are Idaho, Nebraska, and South Dakota. There are no regulations on who can buy CBD, but it may depend on the store selling CBD. And the form of CBD bought, whether it's an edible or smokable product, does not affect whether it's legal or not. As for those of us that live in Arizona, a recently passed law, the Farm Bill, excluded hemp from the controlled substance list. CBD products that contain less than the federally allowed limit of 0.3% of THC are legal in the state of Arizona. While the most widely known form of CBD is in CBD oil, CBD now comes in many different forms, such as snacks like cookies, gummies, or chocolates, drinkable forms such as soda and coffee, as well as a vape form for vape pens as well. CBD also comes in creams and ointments, but I'll be mainly talking about CBD that is taken by mouth. You might also be asking why cannabinoids are getting so much attention nowadays. And the reason is that there's a lot of potential benefits for both THC and CBD. THC having the potential benefits such as pain relief, reducing nausea, helping to boost the appetite or relaxing the muscles, while CBD has been associated with benefits also pain relief, reducing the risk of seizures, being an antioxidant to help the cells from damage, reducing anxiety, relaxing muscles, and also reducing the side effects of THC when used together. You may have noticed I said potential benefits. So why is the evidence for CBD so hard to come by? Well, firstly, studies have been very small with very low number of participants. These studies also don't use placebos like your standard drug trial would. Additionally, the results are often based on subjective or opinionated data such as surveys, and the data is often conflicting. And lastly, the types and strengths of CBD products used in the studies are not always consistent. CBD has been studied for many different conditions. Unfortunately, the evidence has ranged from weak to no evidence all the way to very strong evidence. Similarly, CBD and sleep have had little supporting evidence. There's been no formal studies performed to this day, and some evidence has shown improvement in sleep in the first month, but the effect has varied over long term. Additionally, it also may impact your sleep cycle and can affect the quality of your sleep in the long run. The evidence begins to get a little stronger with multiple sclerosis. There are still limited data with small studies, but there have been positive reports of reducing the spasms that you see in multiple sclerosis. However, more research is still needed. CBD has also been studied in many types of pain. It's been shown to have a possible benefit in pain such as arthritis pain, the muscle pains from fibromyalgia, as well as neuropathic or nerve pain. More research is still needed, but there is a potential that CBD can be used as an alternative to reduce the need for opioid use in pain relief. Currently, the strongest evidence for CBD use is in epilepsy. In certain seizure disorders, CBD has been shown to reduce the average number of seizures per month. If you are using CBD and have a history of epilepsy, do not abruptly stop taking the CBD, or you can increase the risk of having seizures. What CBD companies don't make abundantly clear is that CBD products don't undergo the same FDA drug approval process that prescription medications do. On the left, you can see that a fair amount of research goes into any potential new medication before it is approved for clinical trials. Once it is approved, it'll undergo 3 separate phases. In the first phase, a small group of patients is tested to see if the drug is safe to use. In the second phase, a larger group of patients is tested to find an appropriate dose of the medication. And in the third phase, a large group of patients is tested in order to see if the drug works for the purpose it is intended. Once that medication is approved, you can see on the right in the purple that ongoing research continues to make sure the drug is safe to use in the long run. The first FDA-approved form of CBD is known as Epidiolex, and it's FDA approved for certain seizure disorders. Unlike CBD available in the store without a prescription, Epidiolex has been tested for safety, its ability to work, and quality. So what should you know before trying CBD? CBD may impair physical and mental ability, so avoid driving until you know how it'll affect you. Taking CBD with other medications that can cause fatigue or tiredness can increase that effect further. So how safe are CBD products sold in the store? Since there is no FDA-required testing, this could mean inconsistent amounts of CBD, unlabeled THC in the product, or other contaminants that also may be found in the product. In a study published by the Journal of the American Medical Association, only about 1/3 of CBD products were accurately labeled in regard to their CBD content, which leads me to ask, how comfortable would you feel if the amount of ibuprofen in the product you bought varied depending on which brand you bought? If you are considering taking CBD, here are a few things to expect. Depending on the product, the time to feel the effects may vary, and that could depend on whether it's a smokable form or an edible form. The effects of CBD can last up to 6 hours, and taking CBD with meals can affect how long it lasts, as well as how long it takes for it to start working. Some side effects of CBD include drowsiness, fatigue, and dizziness, as well as some sleep disturbances, weight loss or decreased appetite, as well as muscle weakness and changes to mood. If starting to take CBD, the safest way is to start at a low dose and to slowly increase as needed. As mentioned earlier, food can affect how quickly or how potent CBD can be, so being consistent on how you take CBD is important. You may also be asking, is CBD addictive? And on its own, CBD has not been shown to be addictive. However, as mentioned before, some CBD products may have contaminants such as THC, which do have the potential to be addictive. Which may also lead you to ask, can withdrawal occur with CBD products? And based on current studies, withdrawal from CBD does not seem likely. However, if you have a history of epilepsy, stopping CBD suddenly can increase your risk of having a seizure. You might also be wondering, does CBD show up on a drug screening test? And the truth is that most drug screening tests only look for THC and not CBD. However, some CBD products might have enough THC in them in order to result in a positive. So take caution when using CBD products. When using CBD products, it is important to let your doctor know. When your doctor orders blood work, you may expect to see some changes in your blood cell counts, as well as tests that show how well your liver is working. Like many other drugs, CBD is known to have drug interactions. it can reduce how quickly your body clears other medications. And on the reverse side, some medications may also affect how quickly your body clears CBD. So be sure to ask your healthcare providers about the medications you take and how they might interact with CBD. So in conclusion, due to the limited research with CBD, the dose that works best for CBD is not well known at this time. And because CBD is an unregulated substance, it's difficult to know what's exactly in CBD products, and they may contain contaminants such as THC. Be sure to talk to your healthcare provider if you are considering trying CBD or are already using CBD. And if you do decide to start CBD, be sure to start at a low dose and increase slowly as needed. Once again, my name is John Howard, pharmacy resident at Kingman Regional Medical Center, and thank you for watching.